What makes free and charitable clinics unique from a traditional private practice or some of our colleague clinics across the country and in the state is that we serve the medical, dental, pharmaceutical, and behavioral health needs of low-income, uninsured patients without regard to their insurance status or their ability to pay any kind of fee for those services.
And a lot of people that we work with assume that we're going to be paying the bill for somebody else's care, and that's not happening either. But we exist because of the support we receive from the community. We exist because of the community.
You know, the people that are seen in free clinics are people like you and I. These are people who could be our neighbors, our relatives, people who work as hard as we work but can't afford to be seen in the traditional healthcare system. They don't have insurance, their income is not high enough to pay for the services that they need. And so when you look at the kinds of people that rely on free clinics for care, they come in all shapes, sizes, colors, just like you would in any other healthcare service. But they need a particular kind of care because they have additional obstacles because of poverty generally. And if we weren't here, I'm not sure who would be there for them.
There are many assets and strengths to free clinics, but I would say that the volunteers are probably the greatest asset. Having over 6,700 licensed healthcare providers who give so unselfishly of themselves every single day without regard to any form of compensation is humbling, and it is extraordinary.
What I find very meaningful in this clinic is we're providing really good quality care to a lot of patients who just don't have access. A lot of patients cannot access health insurance for a variety of reasons. It doesn't mean that they shouldn't get wonderful care. And by coming to this clinic, I think the empathy that you get from the other providers here, from even the non-physician volunteers who work here, I think just provides a really wonderful place for our patients to come and feel like they're being cared for, you know, where they may not necessarily get that elsewhere.
I hadn't been to a doctor since I was 9 years old, except for stitches at the emergency room. So that was it. I didn't see a doctor all my life, never. And I came in here and I believe they saved my life. And if I hadn't come in here, there's no telling where I'd be.
When we look at the value of what's delivered in a free clinic setting, it's unbelievable. It's probably the best investment anybody can make if they're going to put their money somewhere. We brag about it being, for every dollar you spend, $8 of value is occurring. And that's because when you look at something like a clinic that has maybe 2,000 patients, and you have a team of, say, 50 or 60 volunteer providers, and you're getting your labs donated and your meds donated, that can translate into $4 or $5 million worth of service and in kind. Where can you go and get that? Anywhere in town. You can't. You know, our healthcare system is nowhere near as efficient as a free clinic system can be, and we still get good outcomes. In fact, many of us get better outcomes than what the primary care systems are getting in the private sector.
Those lacking health insurance and access to care, free clinics have always been there, providing quality, comprehensive care, and will continue to do so into the future.